When I was a child, we would be rounded up at the school to see the dentist. When the door would open, we would see the dentist standing there, literally wearing a butcher's apron covered in blood, and our friend holding their mouth. One kid had 8 teeth pulled in one sit-down. That's just what it was like for us when we were little.
It's impossible for one dentist to see all the people in all the villages in a timely manner. In healthcare in general, primary care physicians are using physician's assistants and nurse practitioners a lot. We plan to do that in dentistry with the DHAT.
It used to be that people in Alaska Native communities would walk around with teeth missing and not think anything of it. Clearly, the tribes were not okay with that, so they took it upon themselves to create a program that would address those needs. It was a game changer. Now we have young people that can smile, big and beautiful smiles. My name's Mary Willard. I'm the director of the Alaska Dental Therapy Educational Program at Ilisavik College.
When I was 3 years old, I was in foster care and I had an abscessed tooth. I was in the hospital for 3 days. Dr. Mary Willard operated on me, and a few years later, me and my 2 brothers were adopted to her. It is hard to get dental care when you're living out in the bush. I've experienced it firsthand, definitely. It's easier now because of the program.
The Alaska Dental Therapy Educational Program was created to solve the problem of high dental disease rates. What we didn't know is all the other things that the program would do. It's provided an economic engine in communities where jobs are hard to find, but now you can go away, get an education, and come back home and have a really great job.
I didn't really have an idea exactly what it was that I wanted to be when I grew up. I went to school to try to become a dental hygienist, but I wanted to do more. I chose the program because it would allow me to stay in my community and help the people that I love seeing on a daily basis. My name is Anna DeGraffnert. I'm from Plummer, Idaho. I'm a Coeur d'Alene tribal member.
We have a very nice dental clinic, but we cannot recruit dentists into the area. I think DHATs are going to fill that gap there. We're looking forward to our first graduate to come home and be the most wonderful role model for our young people going into healthcare.
I know there are communities in the lower 48, like East LA or inner city Boston, that would really benefit from similar programming where kids come and learn what we have to offer, then take it back to the community.
Previously, we had to send people halfway around the world to get this education. We wanted to provide the education closer to home. It wasn't easy. The American Dental Association was not happy with this program for many reasons that really aren't founded. It really broke my heart, but it didn't deter me because I'd seen it. I knew what we needed.
DHATs are having a huge, huge impact. There's a generation of kids that don't have cavities, that have 0 cavities, and that's the first time we've ever seen that, and I think it's amazing.
Now we have research data, evidence, showing that communities that have had DHATs are seeing more patients retain teeth.
They really are the heroes of our communities. Kids see them everywhere. They see them at the school, they see them at the store. It's basic human nature that the people that you know and trust are those that you listen to.
We talk about our young people being educated and coming back and giving to their community. I mean, it's contagious. You know, it builds a relationship with the whole tribe. I think that this has created a standard of living that we would all hope that our tribal members could get to.
To be in a professional position, it says a lot about somebody. It shows the way of life that they're ready to live. To those that think that they can't do it, I just want them to know that they can. There's another life out there for you.
I'm proud of her. She's a pioneer, basically, in her field. She is putting a real role model thing out there for her kids, and I'm just really proud of her.
Our graduates are a face of the future that could be different. Many young people feel like they need to leave the villages in order to have a successful career. This program changes that. It's created hope in communities where hope is not always available. Providing people access to dental care provides them access to a healthier life.